Hi, I'm Barbara Martello. I am the Japanese acupuncture instructor and supervisor here in the clinic at AIMC Berkeley. Japanese acupuncture is another style of acupuncture. It differs from Chinese acupuncture more in the way that a patient receives it. It's very palpation-oriented. Japanese acupuncture evolved out of massage traditions, and most Japanese acupuncturists were blind. So you can't look for a point, you have to feel for the point. So it makes for a comfortable treatment where a patient feels maybe more supported if they're nervous. There's hands on them that are warm, and the needles are much more fine than Chinese needles, so the patient will perceive it as less sharp, maybe less painful, and more comfortable. Most patients in a Japanese setting will fall asleep on the table, which is really nice, especially for those who are nervous. It contains all of those things. Japanese meridian therapy is a modern expression of acupuncture that comes exclusively out of classical texts. Chinese medicine has evolved in China through time and reaction to cultural changes, and that's how it works. In Japan, they received the historical texts that are the basis for Chinese acupuncture in the 5th century, and then Japan went into millennia of wanting no outside influence at all. So acupuncture evolved entirely on its own within the Japanese cultural context. So we see heavy reliance on classical texts in a way that is less common now in Chinese. So point selection is different, the reason you pick the point is different, how you view organ pathology is more of a classical reference than more of a modern evolution of TCM. I was a shiatsu therapist for years, and I was afraid of needles. Got a terrible sinus infection, and my shiatsu teacher, who was also an acupuncturist, insisted that it was the only way to help, and he said, but I do Japanese acupuncture and it's all of these things, and I said, okay. And he gave me a treatment, and I felt very little discomfort, and I felt better immediately, and I realized there was really something to this, and I always wanted to pursue medicine more officially, so I went to acupuncture school knowing that I was in a program where Japanese styles were emphasized and I could practice in a way that was comfortable for me and for the patient.